Hello, Albert here. This chapter has visual aids that cannot be shown on this movie. Please visit the Recovery Today website and download the Stroop Charts, or purchase your copy of any edition of Recovery Today which will have all visual aids needed through these recordings. If you have a Nook or Kindle, or smartphone, you can download any edition of R2D for only 99 cents. Chapter: Visual aids that interrupt cravings. The idea of quitting can make you extremely nervous. The first hurdle you have to face is craving. Craving creates the mental obsession and emotional stress of life without the substance our bodies have grown used to and expect. While detoxing, you experience various symptoms, ranging from mild obsession to the idea of this feels impossible. To help you in these first critical days, we introduce 3 tools to use while you read the rest of our treatment plan and start to incorporate Recovery Today into your daily regime of getting well. In this section, we offer you 3 very effective tools to help you break your habit of craving: the Stroop Chart, the eye movement desensitization and reprocessing (EMDR) technique, and another visual aid, the stop sign. Each tool can be used in conjunction with the other. Each has different directions. The Stroop Chart, the book cover. One of the most effective methods to break your habit of craving is something called the Stroop Chart. The Stroop Chart, developed by John Ridley Stroop, is a powerful psychological tool from the middle 1930s, used today in cognitive psychology. The Stroop effect is created by reading the ink color aloud on a simple chart. Our memories are interrupted by a conflict of sorts that our senses, eyes, see, compared to what is stored in our memories, which causes a natural interruption. You'll find the Stroop Chart on our book cover. As you see, it is a visual mental craving interrupter tool. By using the Stroop Chart, you will create the Stroop effect, a sensory memory process that is interrupted. By using it, you'll break or interrupt your emotional memory that lives in the sensation called craving. First, we need to show our brains a stored memory event. This simple chart shows us rationally how we see or sense memory. The brain can run a different process than the one it is used to, in our case using at the onset of craving. By the term using, we mean returning to the substance we abused or became dependent on. This simple-looking chart can interrupt your cravings. We ask that in your early days you use this at least 4 times a day. It will show your brain how to change its memory/mind. We mention cognitive thought processes in the preface. This Stroop Chart will show you how a mental process works, showing how stored emotion memory will rule automatically and follow a process. Stored memory, short-term memory or long-term memory is a process we rely on. But what happens when we stored the memory and now need our cognitive thinking and reasoning to make a decision? What happens to memory if it was encoded incorrectly when it was being encoded or stored into our brains? Being high while storing memory will filter all that memory with an "I was high" memory stored as my truth, but it is still flawed. What happened if we encoded some memory while our brains were still developing, since development does not stop until the age of 25 or 26? Common sense tells us it is possible we have flawed memories, sometimes referred to as euphoric recall. We remember the fun stuff, not the truth or details of what really happened. However, it will be your truth since it's your memory being used in the daily decisions. The Stroop Chart demonstrates how this memory process works. It will show a basic stored memory and how to stop or interrupt a conflict between what you see, the words, and what is actually being seen, the color. When a craving event occurs, look at the book's cover. Use these directions. First, read the words on the book cover from left to right, top to bottom quickly. Then return to the top, read from left to right calling out the color of the ink. Example: the ink color of the first word is red. The ink color of the second word is blue. Now call out the color of the ink for the remaining words. Try to go as fast as you can. When you do this, you will feel the difference. You will go slower and probably make a mistake or 2. This is called the Stroop effect. Do this 4 times a day, and you will see a marked difference in cravings. It disarms or disables the craving. This is how you undo a thought process. Storing memory in the brain is a sensory process. If it is encoded correctly, It works wonderfully. If it is encoded, remembered, sensed incorrectly, the results are predictable. Our website www.recoverytoday.org offers multiple Stroop charts free to download. Eye movement desensitization and reprocessing, EMDR. Another method for interrupting craving is called eye movement desensitization and reprocessing, EMDR, developed by Francine Shapiro, Ph.D. in 1989. Mainly used in the treatment of post-traumatic stress disorder, PTSD, patients. This tool can also be effective with certain men and women. It is to do with having certain memories locked in, such as a craving memory or trauma event. To break or interrupt the cravings, try this simple method. Close your eyes. While closed, move your eyes hard left, then hard right, then hard left and hard right again. Do this 3 times with your eyes closed. It takes only seconds to do this. This does not work with all people. However, for some, about 40%, it does, with the craving affect are released from the distressed memories that only moments ago were non-stop, allowing a person temporarily to unlock from the locked traumatic memory. Most people are visual in their memories. By closing the eyes and moving them while closed, this seems to break the process of the past visual association. Stop. Reference the image of a stop sign on page 10. Another effective method we have used to help you if you're experiencing physical cravings in the early days of recovery today is a simple stop sign. This is a universal sign. It means stop. Most people, no matter how destitute they are, have a cell phone in today's society. Take a picture of a street stop sign and set it as the screensaver on your cell phone. In group, we use this visually as group meditation practice. Close your eyes, relax, breathe in, exhale, breathe in, exhale. Now visually bring forth the image of a stop sign in your mind's eye. Breathe in, exhale, relax, open your eyes. This simple but effective visual aid has calmed many a mind's eye while craving. These are 3 simple yet very effective tools that you can use in your first days of recovery. Now we can move on to the daily life once you are firmly in recovery. First, let's take a look at what can get in the way.